Good evening. I'm Don Parker, and on behalf of the Playcast and the AV crew, I'd like to welcome you tonight to the evening performance of Burnout. You people here in the auditorium, you need to silence your electronic devices if you haven't done it, off or silent. And you people out there in KOTV land, you can't see it, but our ushers have tried to upstage our actors by coming in costume. So you've got to see this. Come on up forward. Come on forward, you guys. Yeah, they came yesterday. Costume surprised me. Yeah. The other thing I think you would like to know is that the prelude music you've been listening to was, I guess I should say, composed by AI. Yeah, a online artificial intelligence music generator to which I gave some prompts and so some suggestions, came up with that music. And not only that, but during the play, you're going to hear a voice coming from a hospital intercom announcing things. That was made by an AI voice generator. It's a new world. A word about the play. When we look back, it doesn't seem that long ago that we were in the COVID pandemic. And yet, at times, it seems so remote, so far away, so long ago. But even as the pandemic recedes in the rearview mirror, there are still stories to tell. And this is one. And it's to help us remember, and it's a warning not to forget what we've learned. So sit back, enjoy some more of the prelude music, and remember. The play opens in a large hospital ICU room in a Midwestern city during the later stages of the Omicron pandemic. March 2022. Angie Clark, a patient, is in an ICU bed receiving oxygen and IVs, attended by Terry, an ICU nurse.
What are you doing?
I'm replacing your IV bag, Angie.
Who are you?
It's Terry. Terry, your nurse.
I can't see you.
I know, Angie. I'm so sorry we have to wear all this protective gear. I'd much rather be able to touch you without these gloves and talk to you without the mask and shield. But it's what we have to do.
But why? No one's telling me what's happening.
We're protecting you and ourselves from infection.
What? I can't hear what you're saying.
We're trying to keep you from getting another infection. Your immune system is compromised.
What infection? You haven't told me what I have.
Well, we've told you, Angie, you have COVID. The COVID virus has gotten into your lungs.
That's rubbish. I don't have COVID. There's no such thing as COVID. Why aren't you telling me the truth? Is it so serious you can't tell me?
It's okay, Angie. It doesn't matter what you believe. We're trying to help your breathing because of the infection that's in your lungs.
Are you giving me antibiotics? Why aren't they working?
Well, there's no antibiotic for COVID. We've given you an antiviral, and we're using oxygen and IVs to support your immune system.
I told you I don't believe in COVID. It's a hoax. Why can't I get better? All night I couldn't sleep, afraid I'd stop breathing if I fell asleep. It's getting worse, my breathing.
I'll turn up your oxygen. You've got to try to relax, Angie. When you get restless like you are, it increases your oxygen demand. It makes your breathing harder.
How can I relax? I'm scared. It feels like I'm drowning.
I'm here with you, Angie. Hold my hand. I won't let you down.
Don't let go. Don't let me go. Oh, I'm so scared.
I won't. I'll stay right here with you.
Did you talk with my husband? What did you tell him?
I talked with him and your sister last night. I told him you're a fighter, that you're fighting to get through this, that you stand a good chance of recovering.
Only a chance? You mean I might not recover?
Let's think positive, Angie. Concentrate on your next breath. Breathe slowly and deeply.
I might die? Is that what you're saying? I'm going to die? Oh, God, I don't want to die.
You aren't going to die. We're all here to help you get through this. We won't let you die, I promise.
Oh, God, how can this be happening to me? Don't let go. Don't go away. This is awful.
I'm not going away. Hang on. I'll turn up the oxygen again.
I can't breathe. I can't get enough air. I'm drowning.
I'm giving you some morphine. It'll help you relax and breathe easier.
Where are you? I can't feel you. Where'd you go?
I'm right here. Hang on, Angie. I'm raising the head of your bed.
Terry, give me a hand.
Code
Patient
red,
9
code red,
pulled out his
ICU
IVs and
West.
is trying to get out
Code
of
red,
bed.
code red, ICU West.
I can't, Rennie. I'm tied up here. Get in here, Angie. As I'm on the code team, I've got to go.
What can I do?
Stay with the patient. Call the desk if you have to.
Okay,
Don't leave me.
I'm
Don't
here.
go away.
I'm here. I'm right here by you.
Who are you?
It's
I
Rennie.
can't see who you are.
It's Rennie. I'm the aide, the patient care partner.
Oh, I can't breathe. I can't breathe.
Hang on. Where's your O2 level? Shit, it's down to 84. Where's the pull cord?
Oh.
This is Olivia. Can I help you?
This is Rennie in room 7. The patient is crashing. Get a nurse or doctor in here right now.
I caught Dr. Archer. She's on her way.
Stay with me, Angie. Help is coming.
What's the status, Rennie?
O2 is down to 84. Terry's on the code red west.
Get me an endotrach pack stat and requisition a respirator. Hurry. I'll bag her with a face mask until you get back. Breathe, Angie. Breathe. We're going to get you through this. Again, after 2 already today. It's too much. Rennie, man, where are you?
Here's the endo pack.
Crank the head of the bed down. Pull out her pillow. Help me scoot her up.
How's that? Olivia says there's no more respirators in the whole hospital. 3 are being repaired, and they can't get any new ones until next week.
Don't talk to me now. Hang in there, Angie. Where are they? There they are. There they are. Lovely vocal cords. It's in. Give me the bag, Rennie. Okay, all we need now is a respirator. We'll have to commandeer one. I'll bag her manually until you get it. Go see how the resuscitation is going on west. If it's a no-go, bring that respirator here right away. Forget about cleaning it. I can't keep this up for long.
I'm on it.
Why isn't it coming up? Only 88. No, it's starting to drop again. That can't be.
It's because
O2 at max. No air resistance. Bag volume max. Come on, Angie. She's going into VTAC. I'm losing her. Oh, God, I'm losing her. Olivia, call a code blue. Second team, room 7.
ICU room 7. Code blue, second team, ICU room 7.
What do I do now? I can't think. What? First, CPR. I've got to get her to a solid surface. I need help to move her. Where's the team? Where's the team? I can't go on. I can't take another death. Not again. Not again. Not again.
We are in the same ICU room number 7. It's an hour later, and Claire is seated, staring at a clipboard in her lap.
I can finish cleaning up if you want to take a break.
Thanks.
No, really. I have enough time right now. Go get a coffee and take a breather. I didn't see any new admissions when I dumped the soiled linen. I'm sure they can spare you a few minutes.
I don't know, Rennie. I'm not myself right now. I froze when the patient was arresting. I couldn't think. What's the matter with me? I've been training 3 years to be able to handle a code, and when I'm in charge, I blank out.
You were by yourself. What could you do alone?
I knew I needed to start CPR, but she was a big woman on a soft bed, and I'm not strong enough to get good chest compression on a bed. I didn't have a bed board, and the team wasn't coming. I just lost it. I'm a failure. Maybe I shouldn't be in medicine. I don't know.
Sit tight, Claire. I'm going to get you coffee.
How's it going, Claire? Rennie said you were finishing up and might need some help.
I'm okay, Terry. I just need to finish these final notes.
You sure? Rennie said you're having some trouble.
Yeah, I unloaded on him. I got pretty shaken up by Mrs. Clark's death. But I'm okay now, thanks.
You don't look okay. I'm with you. This situation sucks. How can we keep up this pace day after day after day without a break? Come on, we've got to have a break or this pace is going to break us.
Rennie went to get me a coffee. I'll take a little break.
Another thing is this hero stuff. They call us heroes. The media, my neighbors, this fricking hospital. They put signs all over the place and make us out to be heroes. Superhuman rock stars. It's bullshit. They think they're making us feel special, but all it's doing is making us work harder, feel responsible, tough it out. What they're saying is, don't complain. It's your duty to sacrifice and serve. I say, bullshit. They're using us.
Holy cow, Terry. I didn't know you felt that way. You never told me. Hey, man, you're really worked up. Have you always felt like that?
Well, I'm sorry I spouted off. I reach a point every so often, and whatever happens to be near gets the load. I guess seeing you sitting here, brought down by one more unnecessary death, it just boiled up again. I've been telling myself, I've got to get it out. Talk to someone before it grows so big it eats me for lunch. I guess you were the one to get it today, and I'm sorry to add to your woes.
No, I'm glad you vented. It actually makes me feel better to hear someone else is getting, I don't know what to call it, overtaxed, pushed to the limit. I don't know, maybe.
Yeah, I know what you're thinking. Burned out. That's what you meant, isn't it?
No, I don't mean that for you. I see you working longer than your shift requires, filling in where you're needed. That's the first time I ever heard you complain. I can't believe you'd be the one to burn out. I don't see you as a quitter or not showing up.
Not yet, anyway. I guess my venting gives me an emotional break so I can get back into it. How about you? Any thought of burnout?
I can't let that happen. I'm almost through the final year of my residency, and I can't let up now. I've got to keep going so I can start my own practice and set my own hours, much better hours.
Reality check, doctor. Reality check. Have you talked with the attending docs here? Ask any of them about their hours. Okay. They may close the office at 5, but do any of them get home before 7 or 8? Not the ones that talk to me about their hours.
That's not everyone. When I'm on call, my attending tells me to take over at 5:30 or 6. And if there's a problem at night and I call him, he gives me advice. He only comes to the hospital when it's a complicated case or when a personal friend is sick. I'm looking forward to those kinds of hours.
All right, you've got the exceptional attending, but don't forget, this is a teaching hospital. If your patient goes to Valley Medical Center as a practicing doc with privileges, you'll be doing about the same thing you're doing right now, on call every other night, or every other night if you're lucky enough to be in a group practice.
I went into medicine knowing what it might be like, but I didn't count on this pandemic. This endless line of patients pouring into the hospital every day. It's grinding me down. I want to give the best care to each one, but I can't see I'm making any difference. The ones that survive get moved to somewhere else pretty quick. I only see the ones that are spiraling down, heading for a respirator, and God, I can't take another death. I don't have time to process someone's life going down the tubes when I'm trying like hell to do everything I can for them before there's another one going into crisis. When is this ever going to end? I feel completely wrung out.
Welcome to the club. I think everyone on the team's feeling close to collapse, but we come back every day and keep pushing on. What choice do we have? Someone's got to keep the hospital open.
I know. That's what I've been doing for months, it seems. I can't get enough sleep. I keep going over what I did for the last patient, or for the one that keeps getting worse. Did I do everything I could possibly do? Did I make any mistakes that made it worse? There's no answer. I just keep plowing on. I don't want to burn out, but I feel suddenly so useless. I don't know, Terry. I don't know what to do next.
Have you talked with Wilma? I hear she's been helping staff who are close to being burned out.
The psychologist? No.
I see. You think because you're a doctor you don't need to see a staff psychologist. You're strong enough, you're trained enough to handle it yourself.
That's not it. I appreciate what Wilma's doing and she's good at it. It's just that I haven't had the time. And I don't know of any other resident going to see her.
And you don't want to be the first to look like you knuckled under first.
That's not fair, Terry. Why'd you say that?
Because I know you're human. You won't admit you have limits, but like all of us, you do. We're all vulnerable, especially because we care. We wouldn't be doing what we're doing if we didn't have a strong desire to care for sick people. And it pains us when we see someone that's hurting, and it's terribly sad when people die. When's the last time you stopped to grieve when you lost a patient?
I don't know. That's kind of hard to answer. The last time I grieved. Okay, in medical school, I was on a team in a pediatric hospital emergency room. We were trying to save a 5-year-old boy who drowned in a backyard swimming pool. You know, one of those above-ground blow-up wading pools. It was only 3 feet deep, but he was brought to the ER comatose, still with a heartbeat because the EMT guys had resuscitated him. But he kept flatlining, and we worked on him for an hour, and eventually we had to call it. It was obvious he was non-viable. I remember standing there looking at him, just a little kid with tousled blonde hair, lying there on that gurney. Could have been my kid brother. And we had to go tell his parents that he was dead. Me, a medical student in my first experience in a pediatric ER. I had to stand there with the resident and watch those parents go through that trauma. They were crying. Of course they were crying. It was heart-wrenching, and I cried too. How could I not? But afterward, the resident took me aside and told me that my crying was inappropriate, that I was supposed to be strong and help the parents to be strong, to help them not fall apart or become hysterical. By the time I got to my 2nd year of residency, I had become hardened to the point that I could be the bearer of tragic news and stay strong and keep my feelings from showing.
What is it about you, docs? It sure looks like you've got a caring attitude, like when you're spending extra time with a patient who's taking it hard. But do you show any emotions, your inner feelings? I've got to think it's going to get to you. Sometime anyway, after you've had a hard day and things are going especially bad for someone, you've got to feel some wrench of pain or remorse or sadness. How can you not show it? It's only human to be able to feel another's pain.
I'd like to say it goes with the territory, but it doesn't really. I guess it's part of needing to be in control. You know, like making decisions that depend on experience or training, like people who are looking to you to have the right answer. Sometimes it can be decisions that'll affect someone's life. The kind of control, I mean staying calm and confident, being in charge, that's when it's important, no, even necessary, to extend that control to feelings, to try to keep a level head in a crisis and not let feelings cloud judgment. After a while, it becomes a habit, building a wall between professional duties and personal feelings.
But that's got to make unbearable pressure. You can't stuff strong feelings like that for very long without needing an escape valve.
I'm not in the mood to talk about it anymore, Terry. Ask me another time.
All right. I just thought it might help you to decompress.
I'm okay. Rennie was going to get me a coffee. I guess he got busy. I'm going to check the admissions board and touch base with one of the other residents. Then I am going to get a bite at the cafeteria before anything else happens.
All right. Claire, if any time you need to blow off steam, I'll be there for you. But you really ought to take an opportunity to talk with Wilma.
Have you talked with her? What did she tell you?
Well, I was in a stress relief group meeting with her. She gave a presentation to the nursing staff. I thought it was helpful.
But you didn't get any counseling, one-on-one.
I haven't reached that point yet, but I still think you...
All right. I hear you. I might ask for an appointment. I'll see.
We are in the same ICU hospital room just a few minutes later. Rennie and Millie, a housekeeping worker, are cleaning up the room.
Go ahead and start disinfection cleaning, Millie. I'll get these unopened packs out of here and then help you with the cleanup.
This is the third room I've had to disinfect today. I guess the patient in here died, right?
Yeah. Terry told me she was an anti-vaxxer. It's a shame, you know?
Anti-vaxxer. Is that what you call it? Someone who won't take the COVID shot?
Yeah, that's what they're calling it now. Seems most people who are coming in with COVID and keep getting sicker are anti-vaxxers.
I know a lot of people are dying. Is that why so many are dying?
Right, that's what I hear.
That's awful. I hate to think of it.
Yeah, I know what you mean. We've got a shot that'll keep you from getting real sick and ending up in the hospital, and there are people who won't take it. It's strange, hard to figure.
Yeah, hard to figure. Until you got one in your family.
Someone in your family is an anti-vaxxer?
Yeah, my husband.
Oh, I'm sorry to hear that. He's never had the shot?
And says he never will. He thinks it's worse than getting COVID. You know, the side effects. I tell him about the people dying with COVID here in the hospital, but he says it's probably something else they're dying of. I've given up arguing with him.
That's too bad. It's got to be hard on you, him being like that.
Yeah. He's got diabetes, doesn't take care of himself. I can't tell him anything anymore. He won't listen to me. I'm worried he'll get some kind of diabetic reaction when I'm out of the house, and I won't be there to help him or call 911.
I'm sorry, Millie. I didn't know you had all that hanging over you.
Yeah, it's a real problem. That's why I got to keep working to pay for his medicines. He's on disability, which helps, but not enough to buy his medicine.
That's a bummer. Let me know if I can help you, like if you get behind in your work, you know?
Thanks, Rennie. You're a good guy.
I'll run these unused supplies to the stockroom and come back to give you a hand cleaning up this mess. Be right back. Okay. I'll clean up the instrument tray and pick up the trash. You go ahead and wipe down everything. That's strange. Where'd they go? Millie, did you do anything with the used syringes on this tray? There was a pile of them when I left.
Yeah, I threw them away.
What do you mean you threw them away? Where did you put them?
In the trash?
No, you don't put them in the trash. You've got to put them in the sharps disposal container. They're contaminated. You can't put them in the trash. I better get them out. I don't want you getting stuck trying to get them out. They're not in here, Millie.
Then I must have put them in another trash can.
What other trash can? Millie, where are they?
Don't yell at me. I took them. I'm going to recycle them.
Recycle? You mean reuse them? You can't do that. They're contaminated.
They're still usable. They still work, you know.
You don't understand, Millie. They're contaminated. They could make someone sick if they're used again.
Bobby uses them, and he hasn't got sick.
Bobby?
My son. He can't afford to buy them, so he uses recycled ones.
He shouldn't be doing that. Is he diabetic too?
No, he needs them.
He needs. I see. He shoots drugs. Is that it?
Yeah, he's been using for 3 or 4 years.
I don't know how to say this, Millie, but you know you shouldn't be encouraging him. He needs help, not syringes. He should get into a rehab program.
You don't think I've tried? Ever since he started, I've lectured him, pleaded with him, threatened him. Nothing works. I've only driven him further away from me, our family. He's still my son. I love him. I hate to see him this way. I don't want to give up on him, so I, keep trying.
By stealing used syringes for him.
Don't say that. I'm not stealing. They'd only be thrown in the trash anyway.
In the sharps disposal can, that's where they're put.
I try. I'm the only one working in our family. They all depend on me. Some days I drag home so tired I can't cook supper. So they open a can or skip supper. Then I worry that Sam will have an insulin reaction because he didn't eat. I'm too tired to sleep, so I lie there and worry. And then I have to get up early and come to work.
I'm sorry, Millie. I didn't mean to scold you. It's hard for you, I know. You deserve better. Okay, I'll forget you tried to take used syringes home with you. I won't say anything to anyone about it. Now give me the syringes and I'll put them with the sharps.
I can't. I told Bobby I'd bring a few home today. If I don't give him these syringes, he'll take insulin syringes from Sam. They only give Sam enough to last to his next appointment. Without insulin, Sam could end up in the emergency room again. The last time that happened, he almost died. You see, I've got to take these home with me.
I'm sorry for you, Millie. I really am, but this isn't the way to help. You could be making it worse for Bobby, giving him some disease, maybe even COVID.
You're going to turn me in, aren't you? I'll lose my job, and then where'll I be? I'm trying to do the best I can, working 6 days a week, trying to be a good mom, taking care of a sick husband. I can't do anymore. I'm at the end of my rope.
Come on, Millie, don't cry. There's got to be something we can do. I don't want to report this. I don't want to make things any harder for you. What else can you do for Bobby? What haven't you tried? Isn't there some place where they help addicts, like when they get an overdose?
There's a needle exchange place downtown. Bobby used to go there until he stole some syringes and tried to sell them on the street. He got caught, got a commuted sentence, and spent time in a rehab program. 3 months after getting out, he was back on the street seeking drugs again.
Yeah, I see your problem. You can't change him until he wants to change.
You've got to help me, Rennie. I don't know what to do.
Well, you can't take the syringes. That'll get us both in trouble. I can loan you some money to buy your husband some insulin syringes in case Bobby takes them from him. That's all I can think of.
I'm already maxed out on my credit card, and I don't know how I can pay you back. Maybe after next payday, if I skimp on groceries?
Okay, Millie, let's call it a permanent loan. You only have to pay me back if you ever get ahead on your cash. But this is only a one-time fix. I don't have the money to do this again. You've got to push Bobby to get him back into rehab. You've got to show some tough love. You know what I mean?
Yeah, that's what my friend tells me. I don't know if I can do that. I know it'll turn Bobby against me.
For a time, maybe. If he ever gets straightened out, he'll thank you. He'll know you did it for his own good.
Thanks, Rennie. I owe you big time for this.
You're doing the right thing. Don't go jeopardizing your job by doing something foolish like this again.
There you are, Rennie. We've got another admission. Get this room ready ASAP. Any more, they'll have to open the overflow unit.
I've got to clean the next room. See you later today, Rennie?
Right, I'll catch you later.
What are you doing with those syringes? Why haven't they been put in the sharps container?
They got misplaced. I found them while cleaning up the tray.
Well, put them with the sharps and let's get this room ready.
Right. Is COVID catching with syringes? I mean, if someone stuck themselves with a used needle, would they get COVID?
I don't know. That's a strange question. Did you get stuck?
No, I was just wondering, since you guys handle them in emergencies, you know, in a hurry.
I don't stop to worry about it. We've been trained in universal precautions, and I guess it's just habit that we're careful. Anyway, I haven't heard that COVID is caught by blood transfer or needles.
How about drug users, junkies? Do they get COVID from dirty needles?
What's with all the questions? Do you know someone who shoots up? You're not using, are you?
No way, man. I'd never do that. I haven't even tried marijuana, ever.
All right then, why?
Millie's son shoots dope. I was trying to find out for her.
Like I said, I haven't heard of it, but you can get other bad stuff from used needles like HSV, hepatitis, stuff like that. That's why you've got to be really careful with used sharps like needles.
Right, thanks.
You seem like a pretty straight guy, Rennie. Do you think the hospital is treating you right? You know, pay, benefits, sick time?
Yeah, I guess. It's a good job. There's hardly any other job out there I could find, what with the pandemic and all.
But look at the risks you're taking every day. Don't you think you should be compensated for that?
I'm helping people that are sick. I go home tired, but I feel good about what I'm doing.
Sure, that's fine. Do you know what the administrator of this hospital is paid? 6 figures, up in the 300s. I bet he goes home feeling pretty good about that. Compared to the amount of work we do and the risks we take, don't you think we should be getting more?
I'm not complaining. Are you thinking of joining the nurses union? Is that why you know all this stuff? I hear there's a union promoter that's been contacting people. Did he talk to you?
To several of us in the cafeteria. I'm not sure I'd join, but I've given it some thought. Collective power sounds good, like a good way to make our grievances known.
Would you go on strike to get higher pay?
I'd hope just the threat of a strike would help the administration see the benefit of treating nurses and care workers more fairly.
But a strike would be hard on patients. If it leads to less staff, there's bound to be less care for patients.
The hospital's already understaffed with nurses. You'd think the nurses would be more valued and compensated. Instead, we're asked to work longer hours and more days for the same pay.
I thought you guys got time and a half for extra work. That sounds like being treated fairly.
Maybe before the pandemic it was okay, but now we're asked to work longer and do more until we're pushed to the limit. Some of us are thinking of quitting. That would put even more pressure on those that stay. You'd think the hospital would want to avoid a downward spiral like that. It only makes sense. Just compensate us for the level of work we're doing and the risks that we're taking.
Yeah, I see that. But I hear that hospitals are strapped with the overflow of sick people. This doesn't seem like a very good time to use pressure in a strike.
Strapped for beds, maybe, but they're swimming in stimulus money. They could afford it.
You know that for a fact?
It only makes sense. You know what's happening. Just listen to the news. The government is doling out enough to keep hospitals afloat and more.
And most of that money is going for PPE, masks, gowns, and all that. And they're being charged a lot more than they used to for the same stuff.
Yeah. Why are you supporting the hospital? What are you going to do when patient care aides go on strike? Are you going to be a strike breaker?
I don't know. I haven't made up my mind. I just know I wouldn't want to be on the sidewalk picketing when I know there are patients in here needing care.
You think I'm a bad person, wanting better pay?
No, man, you're good, a good guy. I know you care for the patients you work with.
I do. But when I'm tired to the bone, it can be a real drag, especially when patients complain and I'm trying to do the best. That really ticks me off. It's hard to be caring when I'd rather tell the patient, okay, you turn the oxygen up. You get up by yourself and take your IV pole with you to the bathroom. But I can't. Not only would I be fired, but I'd hate myself for doing it.
Yeah, that puts you in a bad spot.
You bet it would. And another thing, you know how much agency nurses get? A lot. One of them bragged that she was getting 32 bucks an hour. That's $7 more than I get. And if it ever came to a strike, it's the agency nurses that'll keep working. The hospital would use them to break the strike.
No, that wouldn't be good. I guess I shouldn't give you a hard time for wanting to get better pay. But it seems to me that a strike's not the way to go about it.
You wait. You'll change your mind. I'm tired, Rennie. It's really been getting to me today. I'm trying to hold it together, but I'm tired. Bone tired.
Take a break. I'll go get the supplies for this room. The patient's probably still in ER, so we've got a few minutes.
Okay, Rennie. Let me rest here a bit, and then I'll make this bed.
You bet.
Rennie said, oops, sorry to wake you. Hope you get a little breather.
I guess I nodded off. I'm not getting much sleep lately. Cricket wakes up with nightmares or something and wants to come into bed with us. Then she's restless and wants to talk. Chuck tells me to go to sleep on the sofa and he'll take care of Cricket. But I end up awake the rest of the night.
How old is Cricket? How long have you guys had her?
Going on 4. We adopted her, let's see, before the pandemic, a couple of years after the Trump election, probably in 2018. She was a little over a year old. What a sweetie.
Looks like you guys got a handful, a lively little 4-year-old running around the house.
It has changed certainly has changed our lives.
Kids. I can't quite see how that would fit with my career.
You still going with that guy?
Which guy?
There's more than one? I thought you had a thing for, what's his name, the senior resident, curly hair?
Nah, that wasn't much of a thing. He may have flirted with me, but he's not my type.
But you were dating. The way you were talking, I thought it was serious.
If you mean Dustin, that's over.
Really? I didn't know. What happened?
I'd rather not talk about it.
Sorry to hear. I hope you're all right now.
Yeah, it's over and I'm moving on.
Moving on is good.
Although I'm not very happy about it. But, like I said, I'm not going to talk about it.
Okay, different subject. Did you get a chance to talk with Wilma?
Hey, don't push me. I'll get around to talk with her when I have time, which seems to be in short supply at the moment.
I'm sorry. I guess I'm pushing all the wrong buttons today.
Not your fault. I'm a mess. My life's a mess. I'm not even going in circles, more like tangles. Why am I telling you this? You don't need to know my problems.
I don't need to, but maybe you need to vent a bit.
You know, you're the easiest person to talk to around here. None of the other residents seem to listen. They all have their own problems and make me feel like mine are trivial. But you listen. I know you have problems, but what is it about you?
Who knows? Try analyzing yourself. Why are you the person you are? Okay. I've been told I'm outgoing. Well, that's what Chuck tells me. He's pretty much the introvert. He spends a lot of time listening to me because I talk a lot. I can feel what others feel by talking to them, watching them, you know, empathetic. Maybe that's it.
Yeah, maybe. More likely than not. Anyway, I thought I was cut out to be a doctor since I was a kid. I was always the take-charge kid in the neighborhood, got the ideas, made the plans, and got the other kids to go along with it. I admired the docs on the TV shows and thought I could do that and be admired like they were. But, you know, reality caught up with me. The hard work of medical school and training was grueling, not what I had figured. But I got by and found I could be good at it. Until this endless COVID emergency. I seemed to be losing any enthusiasm I had for medicine. It's become like, you know, just putting in my time, wanting to get done with residency and move on.
Move on to what?
I don't know. That's what I'm trying to figure out.
Patients here. Hold the gurney. The bed's not ready.
Drat. I said I'd make the bed. Just a minute, Rennie. I'll make the bed in a jiff. Claire, can you give me a hand?
Sure, we'll have it ready in a minute, Rennie.
I'll take it from here. Thanks, bro. I'll help you, Terry. Just give me a minute. Claire, I got to talk with you.
Yeah, what is it?
The patient is Millie's husband.
Millie?
You know, the cleaning woman, the one who does the housekeeping and disinfection cleaning.
Oh yeah, I know who you mean. You say it's her husband? He's got COVID?
Apparently, that's what's on the front of his chart from ER.
Is his attending coming in?
I guess the guy uses the free clinic. The doc on call left orders with the ER. They're on the chart. I guess you're in charge until he gets here.
Right. I'll check him over, get his admission work done, and give the attending a call.
And there's something else you should know. He's an anti-vaxxer.
Not again. How do you know that?
Millie told me. She said he hasn't had any COVID shots and doesn't intend to get them. And he's diabetic.
Get him in here. I've got to hook him up to the monitors and watch his O2 sat. This can't be good.
We are in the same ICU room, and it's now 2 days later. Claire is pulling off her gloves.
Don't take it so hard. It was bound to come to this.
I know. I could tell early on he wasn't going to respond to the antivirals. But no matter how obvious he was heading downhill, I can't stop trying. I feel I have to try equally hard on everyone, no matter whether they got the vaccine or not. No matter if they tell us we're hoaxing them or using them as guinea pigs, we've got to try right to the end. And then, I don't know, admit defeat, I guess. But it's another life that's been snuffed out by this damn COVID. I'm not handling this well anymore, and I've still got to go tell Millie her husband's dead.
You could leave it to the attending to tell the family.
He left orders for me to notify the family, and if they have any questions, they could call him. Questions? They'll be full of questions. They always are. Why did this have to happen? Why him? He was such a great person. I always hear that. It's hard. You know, there are no answers, but they still ask, and I still can't find a good answer for them. I can't.
Take a breather. There's no rush. When you get yourself together, we can both go and talk to Millie.
You're a gem, Terry. Yeah, give me a minute and we can do it.
I'll go ahead and start cleaning up. It's not that much of a mess today. Nothing like after an arrest with the code team throwing their stuff all over the place. I'd say you kept it pretty tidy considering the respiratory staff with all their stuff was in here every 15 minutes, suctioning and leaving the suction bottle full to overflowing. You do a good job with these tough cases, is my judgment.
Thanks for saying, but I really don't feel that way.
Okay, look. I don't know how you're feeling about yourself right now, but think how you'll feel telling Millie about her husband. Picture yourself standing next to her. Don't let your self-criticism determine what you'll say to Millie. Think how she must feel. Think how you can sympathize, even empathize with that. Tell her in a way that lets her know that you care. I know you can do it.
You know, Terry, you should be a psychologist or a motivational speaker. But thanks for the pep talk. I need it. Did you ever think of being a social worker or a psychologist? Millie, what are you doing?
Come on in, Millie. We're just getting ready to go find you.
I know he died, didn't he? Sam's gone, isn't he?
Yes. Yes, he died just a few minutes ago. We were coming to tell you.
Come sit, Millie. Let's talk a bit.
Thank you.
Dr. Archer has been Sam's doctor for the last 2 days.
I'm so sorry, Millie. We did everything we could for him. I made sure that he had every antiviral that could help. We got him on our best respirator, and the pulmonary team was right here with us. We just weren't able to beat the COVID, although we tried. We really tried.
I know you did. I know you're a good doctor, Dr. Archer. I told Sam he should get the shot. I told him when I saw every day here in the hospital all the people dying. I tried to get him to take the shot, but he was so stubborn. He wouldn't, no matter what I said.
I can't believe what that put you through. I know you did your best to take care of him.
He was a good husband. Even though he gave me a hard time sometimes, he was a good man.
When did you get married? Tell me how you met Sam.
He worked for the zoo. You know, when it was out by the water plant? I'd go down on Saturdays to be with the animals. I wanted to be a vet when I was growing up. I just liked being with animals. I especially liked being there at feeding time, when the animals would all be out looking for lunch. They were so much fun to watch. Well, I got to noticing this young man who fed the animals. There was a bench near where he fed the warthogs, and I'd sit there and watch him. I guess those critters can be unpredictable at times, but he seemed so at ease around them. He'd put down the feed mix with all the warthogs standing a ways off watching him. When he stepped back, they'd all rush up and start rooting through the grub. Some would get down on their front knees and just gobble it. There was this little runt to the pack, and he was always being pushed away and wasn't getting a chance at the food. So Sam would go right into the mob of those warthogs chowing down, and he'd push some of them out of the way and help the little guy get his share. One day, I was there and I saw it. Sam got pushed back. One big warthog gave him a shove in the butt and sent him sprawling in the pile of food scraps. Mostly looked like garbage to me. Sam got up, sputtering, saw me looking at him laughing. He came over, and I thought he'd be angry with me for laughing at him, but he was laughing too. We got to talking, and we've been laughing and talking ever since.
What a wonderful story. I can see how special he was to you.
Thank you. That means so much to me now. I'm going to miss him so.
I know. I'm sure you're going to miss him. I can't imagine how you'd not miss him. That's okay, Millie. Let it come. It's all right. I understand.
Thank you. Thank you.
We are now in the office of Wilma Kettering, hospital staff psychologist. It is 2 weeks later, and Wilma is seated at her desk.
I hope I'm not too late.
No, not at all. Come on in. How are you, Claire?
Better than I was. I just had to get my head together after I called you, make some decisions before coming.
Usually it's the other way around, but you're here. Tell me how it's been going for you.
I had my third-year evaluation. Residency ends in 6 weeks. There will be a formal ceremony in the auditorium where we get our certificates, masked and 6 feet apart, of course. At least I now know I get my graduation papers. I was beginning to wonder if I'd be able to finish, to be at the ceremony, but I guess the residency director thought I did okay, and so did the specialists I rotated with. Maybe I had a poorer evaluation of myself than they did.
Why do you suppose that is?
I don't know. Self-doubt? I used to think I was the positive thinker, the take-charge person, the overachiever. Lately, it seems I hesitate before making a decision, double-checking myself.
Any idea why the change?
I was blaming it on the pandemic, being overworked, figuring there were lots of stress factors. But now I'm not sure that's the only thing.
So you think there's something else at play here? Have you given much thought to what that might be?
I was hoping you could help me figure it out.
Okay, let's look at some possibilities. Have your expectations for the rest of your life changed?
You mean what I want for my future? I know I still want to continue in a medical career. That's always been my goal. In fact, I can hardly remember a time when it wasn't my life's goal. That hasn't changed.
I see. That's the trajectory you feel you're on. Do you feel motivated to move forward toward your stated goal as if it's pulling you on? Or do you feel like something's pushing you forward?
Pushing me? You mean something from my past?
Could be. Any thoughts?
My past? Well, my parents. They've always said I could choose any path in life I wanted. They've been supportive and they say it's really my choice. But, yeah, if I start thinking about doing something other than medicine, I feel a little guilty, like I'm taking the lower road, something like that.
Why would you feel like that when your parents let you choose?
I hadn't thought about it, but I suppose it's because I'd feel like I would be letting them down.
Is there anything they've said that might make you feel that way?
No, like I said, they've been very supportive.
Both your parents?
Yeah, Dad doesn't always verbalize his support, but he seems pleased with my progress. Mom lets me know she's proud of me.
In what way are you like your parents or not like your parents?
People tell me I'm the spitting image of my mom, but I seem to think more like my dad. I guess I'm a mix.
Tell me about your parents, what they do in their past.
Dad's a vascular surgeon. They live in Baltimore. He's been practicing in the same hospital since he finished his specialty training.
And your mom?
She trained as a nurse, and before that, she was an Army medic.
Was she deployed?
Yeah, she served as a frontline combat medic in the Gulf War. She called it Operation Desert Shield.
And that occurred in the early 90s, I believe.
Yeah, around then. I was born in 1992. She was mustered out in 91, and I guess Dad and Mom had a second honeymoon after she came home. And 9 months later, I was the result of that.
Has your mom talked to you about her experience in the Middle East?
Not until I was in high school. Before that, I never heard her talk about it, not even to Dad, at least not in the presence of my sibs and me. But when I was in high school taking a civics course, she told me some stories about her experience in Kuwait and southern Iraq. I was surprised she'd never talked about it before. She was either holding back for us kids, or she really didn't want to talk about it. She saw some pretty horrible stuff in the aftermath of the big push into Iraq. I finally put two and two together when I was studying PTSD in a neuroscience class in medical school. Mom may have shown signs of PTSD during my early childhood, but later seemed to get over it. I think she might have had some counseling for it.
Have you ever thought that what your mom experienced might affect you?
Affect me? You mean by listening to her stories about the war?
You know about epigenetics, don't you?
Well, yeah, sure. Wait, you're thinking that's what might be affecting me now?
It's definitely something to think about. You said it was a good possibility your mom had PTSD as a result of her wartime experiences. Do you remember any time she had trouble with stress, dealing with a stressful situation or decision?
I always thought it was a personality thing. Mom could be hyper or moody, but Dad was always pretty steady. But yeah, there was one time I was concerned for her. Dad was late getting home. There was a winter storm coming in and the roads were going bad. We got a phone call from the ER asking if Dad was at home. He wasn't, and he wasn't answering his pager. Mom always worried when Dad was driving in bad weather, and this time she must have thought the worst. because she lost it. I don't ever remember seeing her being so upset, almost hysterical. I had to calm her down and help her decide what to do. Come to think of it, that also happened on a family trip we were on. There was a loud crash near a construction site we were walking by, and Mom froze and was irritable the rest of the day. Maybe there were other times that I just took as the way Mom was.
You said your mom had psychiatric counseling. Were you aware of any clinical diagnosis?
No, I was never told anything about it. But you're thinking I could have intergenerational stress response.
Consider it. We know that severe stress or trauma can cause genetic changes or resets, affecting genes that control stress hormones, and some of that can be passed on to the next generation.
Yeah, that's an epigenetic process. And in our genetics class, we learned that it can be passed on to the next generation.
To respond to stress in a similar manner as the parent.
Right. That could explain why I froze in a highly stressful situation when I thought I knew how to handle it.
I think you put that very well. Does it make sense?
Yeah, it does. I don't know why, but that actually makes me feel better. At least it's better than thinking I am incapable of dealing with a tough situation.
And it's treatable. Just like your mom got help with some good counseling, you can reduce or get rid of that stress response by working with a good psychiatric counselor.
That makes so much sense. Yeah, it all fits with what I know about epigenetics and my mom's experience. I was conceived after Mom went through some terrible situations, dealing with horrible war injuries and a couple of close calls for her unit. I don't know why that never occurred to me before.
It's often hard to see things in ourselves that seem so obvious to someone else, but I think you're on the right track. Would you like me to give you some stress-reducing tips you can use?
Yes, that'd be good. Then I'd like to talk to my residency director about getting into a therapy program, maybe before I finish my residency. That way I can get insurance coverage with the hospital before I'm out on my own, with a big debt to start paying off.
Good thinking. And I want you to know, Claire, from what I see in you and know about your work here, you have a good head on you. You're smart, and you can work through difficult decisions and come up with a good plan. If you can control your negative stress response, you'll make a superb practicing physician.
Thank you. Do you want me to follow up with you again?
Not necessary. I've got more than I can handle right now. Get yourself a good therapist. But if for some reason you need to talk, just let me know.
I sure will. Thanks. You said you'd give me some tips for stress release.
Let's start with some deep breathing practices.
We are back in ICU room number 7, the intensive care unit. 5 weeks later, Terry and Claire are setting up supplies.
Have you heard which patient we're getting?
Not yet. ER called and said they're still trying to intubate one of them. The other two can just go to the medical floor. They haven't told us any more about the guy needing a respirator.
Almost certainly a COVIDer, although maybe not. We've had only 9 this week. That's a definite drop from last month.
I can't even remember last month. It seems like ages ago. You think we're getting accustomed to running on automatic, or is this a real slowdown?
I think we're keeping up better, you know, staying ahead of the curve. What's the holdup? If the patient's on the way, why hasn't this room been disinfected? Where's the disinfection team?
Well, we're short-staffed today. One of the crew, Millie, is out.
Out with COVID? Millie has COVID?
No, I hear she's been let go.
Wait a minute. You mean she's been fired?
Well, I think she's on unpaid leave while she's being investigated.
Investigated for what? They better have a good reason. The poor woman lost her husband last month.
From what Rennie told me, he stopped her once for trying to take used syringes, and yesterday they found new syringe packets in her coat pocket. They'd been looking for someone taking them because inventory showed syringes missing from several supply rooms.
Poor woman, as if she didn't have enough problems. What could she want syringes for?
Her son shoots drugs. Apparently she helps him find clean syringes so he doesn't have to use the contaminated ones.
How do you know all this?
I think Rennie's been trying to help Millie, to not take syringes, I mean, trying to help her with her son's problem, you know.
That's like him for sure. But come to think of it, where is Rennie? I haven't seen him all day.
You didn't hear?
Hear what? What didn't I hear?
Rennie has COVID. He's at home monitoring himself. Family doc is following him.
Shoot, that's a bummer. Another staff person out with the cursed crud. Why does it have to be the best people who get it? The ones who go the second mile and show up when you most need them?
Maybe that's why. They put themselves in harm's way because they're the good people they are.
Yeah, for sure. I hope he gets over it quickly.
Well, he'll have to stay in quarantine for 2 weeks, plus up to 10 days after he's symptom-free or tests negative. He's going to be gone a long time.
I'll probably be out of residency by the time he gets back. When you see him, tell him I admire the way he works and that he's a really good guy.
Sure. So, it's next week or the week after that you're finished residency and you get out of here. It must be nice to see the end in sight.
You make it sound like I'm abandoning ship, deserting you guys. I'd rather not. But when I'm no longer a resident, the hospital stops paying me, and I can't even enter the hospital without having privileges to admit my own patients.
Regardless, it's one less medical provider on the team.
The residents all move up, and one of the new third-year guys will be assigned to ICU. Someone will take my spot.
Yep, I'll be breaking in another resident trying to learn the ropes.
Boy, are you ever a grouchy naysayer today. What's your beef?
I guess it's everything at once. Rennie being out for several weeks, you leaving, and new residents coming in. Maybe it's just catching up with me, the letdown after the crush of the last few months.
Yeah, isn't that typical? You run on adrenaline during the crisis, and when it's over, you get a big letdown. But look at the bright side. At least you didn't get COVID.
You're pretty upbeat today. Did someone slip happy pills in your morning coffee?
Ha, you're funny.
But seriously, do you think people under stress, especially those near burnout, get COVID more easily?
Maybe. It's a known fact that chronic stress can lead to reduced immune response, so I suspect there might be a connection between stress and getting COVID. With the stress we've all been under, it's a wonder more of us didn't get it. Why do you ask?
I was thinking about Rennie.
Of all people, I thought Rennie was handling it pretty good during the crisis, not showing stress like most of the rest of us.
Early on, yes. But lately, I could see it in his eyes. He didn't have that sparkle that kept us all going. He hasn't been himself the last few weeks.
But things were starting to let up. Why would he be like that now?
I don't know. Maybe some home problems.
Do you know much about him? His family or whatever?
He's second-generation Mexican-American and about as American as any of us. He did tell me his parents aren't doing well. His dad still works in some landscaping company. At his age, I guess the work is really hard on him. I don't know anything about his mom.
Is he married?
Yeah, I guess. He's talked about his kids. I don't know how many, but I suspect he's the main breadwinner in the family.
Does the hospital give paid sick leave for patient aides?
For a week. And after that, they're on unpaid leave. I guess Rennie will have no salary for a while until he gets out of quarantine.
That's a shame, him being the main wage earner.
That's exactly why we want unions, to negotiate better benefits, if we can get enough people to sign on, that is. When I talked to Rennie about joining the union, he hesitated and said he didn't feel comfortable about doing that.
I bet I know why. He was thinking about who would take care of patients during a strike.
Yeah, that's basically what he said. But now maybe he can see the wisdom of having some union bargaining power.
Don't you go giving him the strong arm to join a union while he's down with COVID.
Strong arm? Hey, you know me, that's not my style. You're casting me as the bad guy.
Stop complaining. You'll be rid of me by the end of next week.
To tell you the truth, I'll miss you. I'd hug you, except for all this PPE we've got on, which makes it about as comfy as hugging a lamppost.
Now you're trying to be sweet. But yeah, I'll miss you too and the rest of the team. But I won't miss this rat race and the discouraging days when we'd lose one patient after another.
Regardless, we'll carry on without you. No rest for the weary.
Right. There's a tear in my left eye, and I'm playing my little violin.
Hey, Terry, the cleaning crew is stuck on ICU West. Guess you'll have to do the disinfection of room 7.
Thanks, Olivia. That's not in my job description. At least it wasn't before the pandemic. Guess I better get busy.
I'll give you a hand.
You don't have to. You're probably needed somewhere else.
No, really, come on. It won't take long.
It is now 6 months later. Terry and Wilma are in the hospital coffee shop, sitting at a table and drinking coffee.
Well, not many people here this hour.
Too close to quitting time.
You must be on a late break. Extra busy today?
I'm putting in some overtime, covering for Cheryl, who's out with COVID.
How are you coping these days?
About the same. I'm afraid Chuck gets my venting when I get home. How about you?
Thanks for asking. Few people do. I'm getting some counseling myself with a colleague who volunteered to check my coping mechanisms. So far, I'm able to function normally, with some ups and downs, of course.
I can't imagine how you can see one person after another complaining or falling apart without getting burned out yourself.
I'm monitoring myself. If I start noticing signs of stress dysfunction, I back off, take a break, or call my backup psychologist to come in.
You have a backup, really? The hospital must put high value on having a staff psychologist on hand and paying for it.
It's a good job and much needed.
Hi, Terry. Hi, Wilma.
Hello. It's Claire. It's Claire, isn't it?
You forgot me already? In 6 months?
Not likely. It's just that we've had 2 residents to rotate through ICU since you left. No, how could I forget you?
Yeah, the weepy one.
No, the caring one. Yeah, we had some good conversations.
Good to see you again.
Thanks.
How's it going since you graduated from residency?
I decided to do a fellowship in psychiatry.
I thought you were leaning that way. When you came in to presumably say goodbye, you were asking a lot of questions about my practice.
Talking with you and my residency advisor helped me make up my mind.
So how's it going?
Great. I'm taking to it like a duck to water, and I'm learning a lot about myself.
How so?
What I experienced during the pandemic helped me see mental health problems from both sides. We doctors spend so much time focusing on other people, we don't easily notice the effect on ourselves until it starts to impact our work, the way we react and treat patients.
It seems to be built into the system. There's a direct link between the superhuman expectations put on doctors and nurses and the high levels of burnout in the medical field.
Yeah, the hero label and the expectations that come along with it.
It'll take a new way of thinking about the psyche of healthcare providers to recognize that people working in this profession are first of all human.
And the things we think and feel and need are the same as anybody else.
I should be taking notes.
Maybe you should. Have you been looking at your personal journal, hopefully you made one, about your experiences during the worst of the pandemic?
No, I never had the time to journal, but I could use what I wrote in my letters to my mom. I pretty much told her everything.
Wow, you write letters? You don't use email or texts?
Mom's old-fashioned. She much prefers letters, so it's a good thing. I can ask her to send me all those letters and use them as my journal.
I'd call that a good start. Good luck in your fellowship.
Thanks. I learned a bunch from you, too. No thanks to the pandemic, which we're all aware is not by any means over. You know it's going to linger. But I've been wondering and worrying about the next pandemic.
You know of another one coming?
Not specifically, but it's inevitable. There's bound to be more cross-species jumps of potentially deadly viruses.
And the risk increases as the world gets more populated with greater human encroachment on wild habitat.
And population density with more crowded conditions will make contagion spread more rapidly.
Not to mention worsening stress that'll make us more vulnerable.
How's the healthcare system going to handle that? Think of the added stress that's going to put on healthcare providers.
Hold on. What are you two saying? You really think a worse pandemic is coming?
I guess we'll be finding out, won't we?